Hello and welcome to today's Spigit webinar, Pioneering a New Era in Process Improvement with Dr. Jill Waters, Process Improvement Professional at Adventist Health, and Duncan Chung, Director of Product Marketing at Spigit.
Thank you, Hannah. Good morning, good afternoon, and good evening to audiences around the world. My name is Duncan Chung, Director of Product Marketing at Spigit. Today I'm very excited to be sharing with you and having a discussion with Dr. Jill Waters from Adventist Health about process improvement and how a culture of innovation is actually the new era for process improvement. So perhaps before I get started, just a quick word about Spigit for those of you who are not familiar with us yet. We are a complete ideation and innovation management solution. And what makes us special is that we are an enterprise solution that combines technology and our unique methods and the crowd science algorithms and services to solve complex business problems, and process improvement and continuous improvement are some of the key problems that we help businesses solve today. In effect, we help you tap into the collective intelligence of your employee base, of your customers, of your suppliers, and your partners to go and find the best ideas so that you can make the right decisions and scale it to your enterprise so that you can continue to lead in your industry. Okay, so just by way of background, we are actually we're the market leader in our space. We have over 6 million users in over 150 countries, and to date we've run over 13,500 communities and challenges. These are innovation or ideation projects, and have helped companies generate over 100,000 winning ideas that they have taken through to implementation. And we're across in every major industry in the world: banking, finance, insurance, healthcare and pharmaceutical. We are in engineering and construction, manufacturing, everywhere. So we see a broad spectrum of places. And today we'll be talking about how Adventist Health applies process improvement, and also how it applies the collective intelligence to improve its process improvement process. Yes, it is in the healthcare industry, but this is actually applicable more broadly. And as you know, process improvement is something that got popularized in the manufacturing industry in the 60s and 70s, but really it has taken root in many other industries, including healthcare, banking and insurance, telecommunications, consumer packaged goods, apparel, you name it. And the next frontier right now, and I'm going to give you a sneak preview, is that the integration of the culture of innovation is the new frontier. And so over half of our customers alone are actually using Spigit to tap into collective intelligence, to improve process improvement, and to augment their existing processes, sometimes even replacing their process improvement management system with Spigit in order to track impact all the way through to implementation. Some of our customers, according to Forrester, the latest report is that there are incremental gains and returns over the years, and even in risk-adjusted returns. We're looking at, in the first year, approximately 100K of savings, and then that snowballs up into year 2, year 3, and year 4, and companies can expect to see approximately $6 million in cost savings from process improvements, and this is after risk adjustment. So it's a very powerful tool to think about, and also a powerful methodology to think about how we can integrate collective intelligence into process improvement. So today we're going to be looking into how Adventist actually does that. So I'm very happy to be speaking with Dr. Jill Waters, who's the Lean Six Sigma Coordinator and Process Improvement Professional in Adventist. She has a ton of experience in this field, and has actually spent 2 years in residency in the healthcare innovation, and obviously is a PhD in clinical psychology, and she co-founded the Innovation Award and winning worksite wellness program at Adventist Healthcare. So she's a leader in Adventist Health. So without further ado, I'd like to give Dr. Jill Waters perhaps you can say a few words about your role and your background at Adventist, and tell us a little bit more about Adventist being an innovator.
Absolutely. Hi there, and thank you. I'll start with Adventist Health. Back in about 1860s, we were, I would say, major innovators in the healthcare arena. We promoted radically different concepts of nutrition, exercise, sanitation. The fact that we were telling patients to get outside and get some sunlight and some preventative exercise was not the norm. We challenged the status quo the whole way. More than a century later, while we were still sponsored by the Seventh-day Adventist Church, we had about 160 hospitals and nearly 500 clinics, and the church recognized that we needed some formal governance underneath healthcare organization. In about 1972, we formally started as Adventist Health West. Adventist Health has several different companies within it. So I work for Adventist Health West. Adventist Health East actually has partnered with Disney to build the hospital of the future. So some of us are still in the innovative space, while as our company itself about 10 years ago realized that we probably needed to start innovating. Otherwise, we would end up the next blockbuster of healthcare. My role in Adventist Health, I actively did not want to work in healthcare. My parents and my entire family are either doctors or hospital CEOs or something. So I tried as hard as I could to stay out of it, but I loved innovation. And when Adventist Health started playing around with what we could do differently, I jumped on board and have worked for them for the last 7 or 8 years and have loved it ever since. Currently, I work for our Process Excellence Department in our Central California region, which includes 3 acute hospitals and about, I don't know how many clinics, either 30 or 68, depending on how you're counting clinics.
Very good. Thank you, Jill. And I'm curious. So you've been at Adventist for a while now, and you've seen a lot, both from the corporate side as well as now in a sort of regional level. What was recounting sort of your early days? What was your experience in process improvement in the early days?
My first experience, so I actually started in our nutritional services, starting a coffee shop for our Ukiah hospital, and we ran into some bumps in the road, as you do starting any new sub-business, and our equipment was taking quite a while to come in. So while I was fully trained and on staff, they kind of placed me in various departments to be useful until the coffee shop officially opened. And one of my first kind of placing in the departments was medical records. So I had filed and stuff as a kid on summer vacation, and I was familiar with the gist of medical records, but we were starting the process where we were going to the electronic medical record, and one of the processes was called CPDI. I can't remember what it stands for, but it's basically where we scan the papers into the electronic medical record. And one of our hospitals was about 3 months behind, and they were still learning the process and what it looked at, and they were doing quite a bit of extra work that wasn't necessary with the new electronic process. And I was sent in to figure out how we could catch them up, and in less than 2 days, it was easy to identify the extra steps that they were taking and train them on how to eliminate those steps. And I had no formal Lean Six Sigma training at that time. It was just kind of the power of observation, and it was something that came very naturally to me.
Right.
That was kind of my first foray.
Exactly, and that's actually a beautiful story, because it might seem trivial, right? A coffee shop and then electronic medical record system implementation, but this is how process improvement happens, right? It's the power of observation. It takes one individual to spot, oh, okay, I can do this actually more efficiently and cut down the time and help people do it faster, better. And it's through these collective of the small incremental improvements that you identify huge systemic changes that can actually help the company move forward in a very big way. So tell me more about process improvement, the history of process improvement at Adventist. How did it come to be in the first place?
So I can give you my brain's opinion or my observations on that. I would love to find out a little bit more of the truth behind everything. I do know that approximately, I would say 10 to 12 years ago, our hospital started taking on the Lean Six Sigma side of process improvement. I knew quite a few directors in our system or people that had black belts that led this process improvement kind of thing. To my observation, about 3 years ago, I made the realization that not everything could be covered within Lean and Six Sigma. So I've worked with actually our Chief Innovation and Human Performance Officer started our innovation department for Adventist Health at our corporate office. And with her help, we've kind of looked at, so when does innovation take over from the traditional Lean and Design for Six Sigma methodologies? And what we've come up with, also with the help of many other brilliant minds at Adventist Health, we've come up with kind of what you see on your screen right now, which is when we're looking at a process or when we're looking at continuous improvement and we're trying to decide what we do, we have three choices, two of which I'm going to talk about today. First off, we can design for Six Sigma, but we'll leave that one kind of out of the conversation of today. Second off, more traditional, we lean it out. So we eliminate the waste within the processes. And then what do we do when we want to radically change the process completely from the design thinking standpoint? What's best for the patient? Sometimes a lot of our processes were put in place due to what was necessary 10 years ago, and it's no longer necessary. And that's when we go for innovation.
Right. And where does this apply? For those of us who are not in the healthcare industry, just curious, some of the application areas when you apply this decision matrix.
I cannot come up with an example when it doesn't. I would say it mainly revolves around processes, but I mean, even when you're looking at strategy or business development, there's a lot of things. Everything kind of revolves around processes, whether they're formalized and standardized or not. So I would even say when we're looking at our clinics or when someone's looking at a service line that might be public facing, you have a choice on how to make it better. You can eliminate waste, you can design for perfection, or you can completely innovate and change the status quo. So to me, I see it applies to a multitude of things.
Right. And I imagine a lot of this ties back into these strategic objectives, which are, improving patient experience, improving quality of care, and also at the same time taking cost and taking waste out in the system so that you can serve more patients in a more efficient way.
Absolutely. I'm a fan of if you're not doing something that supports strategy, you might not be on the right path in the first place.
Right. So tell me a little bit more about this what do we do decision matrix. When you talk about leaning it out and designing for Six Sigma, what's the big difference there? Because some of the terminology here, I imagine a lot of our audience here are thinking about Lean and Six Sigma. There are similar processes. One's more about quality control. One is more about improving efficiency, taking waste out. So how do we, when given a process, how do you distinguish it, and how do you, when does it step into the boundary of, wow, these two don't actually work, we actually need to innovate?
Wow, I have been rattling that around in my brain for a while now. I think, so traditionally, if, let's see, how can I explain this? So if we want a certain outcome every single time, and our outcomes are completely not similar. So for example, I'm trying to think of examples outside of healthcare, but I've got to use healthcare. If a patient comes in for an earache in our emergency room, first off, it's probably not the most appropriate use of an emergency room, but it happens all the time. So some of those patients experience maybe a 1 hour wait until they're let go with their antibiotics. Another patient might be in an emergency room for 12 to 14 hours. They might have radically different service when they come into our Hanford emergency room as compared to maybe one of our competitors' emergency rooms. And when we're looking at how can the quality of that encounter be standardized, how can we design it so that they are within maybe 5 minutes of every encounter that's similar, that's kind of a design for Six Sigma process. How do we design it so that the quality and the outcome is 99.999% of the time the same?
Right, right.
And then when we look at that same process, so let's say that we 99.99% of the time we can get a patient with an earache in and out of the ER in 6 hours. Well, clearly that's not good enough. So that's when we kind of look at lean. So how can we take out some of that wait time, those wastes, and then we kind of map out the process. We can identify easily. Actually, I found that the people that work in the environment absolutely know where the waste is occurring. So it's not that difficult to identify it and get a plan around it. But that's where we may do some training on what are the 8 different types of waste, what do you see in this environment, and what can we attack first. And there's some tools around that as well. The last one is, and then actually within the Lean Design for Six Sigma kind of base of the pyramid where we've started, we have, at a future slide, we have a layout of which kind of project do you pick underneath this.
Right.
And then whenever something doesn't fall within that, when you're trying to radically change a concept, so let's say that we don't want our earaches to come to the ER. We want them to go to urgent care across the street that's better equipped, can get them in and out faster. How do we innovate? How do we completely change the paradigm of them coming to the ER? That's definitely innovation. But I would say that you can innovate within Lean and Design for Six Sigma as well. And right now it's kind of, we ask the sponsor, whoever's asking the challenge or whoever's trying to solve the issue, what are the results you're looking for? And if all they're wanting to do is shave off 4 minutes, it could be innovation, it could be lean. Honestly, it could fit into either one of these. It's kind of where the sponsor's passion takes them right now. We're trying to work on defining this further.
Yeah, so which department is responsible for looking at the issue? You mentioned that there are sponsors. Are individual care facilities coming to a process improvement team and then they bring them in as internal consultants to look at the issue, or that it's a more free form where the process improvement team goes into a hospital and then goes and spots where inefficiencies happen? How does this sponsorship work?
So within Adventist Health Central Valley region, we have pushed very hard. Actually, we have this great mind named Bruce Sharp that has amazing experience in the industry of Lean Six Sigma, process improvement. He actually started and sold multiple companies. We're so fortunate to have him. He has pushed very hard before I even came on to put the power back in the directors. So, for example, if there's a director of our medical surgical floor, there's no reason that we should come in and tell her where she needs to improve. She knows where she needs to improve. So he spent most of the years before I came in training them, giving them the tools. So it may be an equivalent of a green belt in Lean Six Sigma, but even most of them probably could get their black belt if they were looking at going that route. But getting them the information, training, and then the requirement of having one process improvement project per year started a couple years ago. I believe last year the requirement was 2, and we're looking at next year they're required to do 3 process improvement projects per year. And actually, if you wouldn't mind going to the next slide, I think that let's go one more and come back to this one.
Sure.
So this is when we look at how do we help them, so we train them on Focus PDCA, which is in front of you. We train them on workout. And then whenever it comes to a true Lean Six Sigma project, that's when my team tends to come in and do some facilitation. But even then, we really try to allow the sponsor, the director of that department, to do as much of the facilitation as they're comfortable with so that we can work ourselves out of a job. And then to explain this a little bit, on the vertical axis, we have the problem complexity. So if it's something that's completely within the span of control of maybe 1 or 2 people, there's no need to involve the entire Lean Six Sigma process or the process improvement department as a whole. And then you look at the number of people or departments involved, and the more departments and people involved is the more when we go to traditional Lean Six Sigma projects. Other than that, if it's simple, we try very hard to do just a rapid plan, do, check, act cycle. The acronym of FOCUS beneath just helps them find an opportunity, understand root cause, organize to improve, clarify, and select an improvement is what kind of FOCUS stands for. But it's just plan, do, check, act cycles. The workout structure in the middle is where we come together for one day with, this is kind of a Kaizen for anyone that has Lean Six Sigma knowledge, but we have worked with GE to develop what we call our change acceleration process. So this is kind of the psychology behind change. And one of the structures within that was called workout. So that's what we're referring to when we say workout there. And only in maybe 5% of our projects do we ever actually do a Lean Six Sigma robust process of improvement and design.
Right. So if I'm understanding this, and I have less experience in how you guys implement this framework, but is it essentially to say this is an escalation matrix where in the bottom left corner, it's the smaller issue, less complex, fewer people involved, and therefore take care of it by yourselves, just do it, right? And then as you go toward the top right corner, where you talk about Lean and Six Sigma over here, it typically involves some of the more complex projects that involve more people, and you probably bring in some experts to help solve the problem, and that the solving of those problems could have implication for not just that one facility, but also for the region or even for the company-wide. Is that the right way to interpret this?
Absolutely. Great observation.
Okay. I see. Okay, so I think I'm getting it. And so these things with acronyms, every organization has their acronyms like Workout, Lean Six Sigma, Focus PDCA. These seem to come with a body of knowledge that not everybody in the organization will be immediately familiar with. So whose job is it? Whose responsibility is it to go and educate the local, maybe the medical directors or even his or her team on these different methodologies? How do you disseminate this information so that everyone can have in their minds, oh, when they spot a problem, this is how complex it is, and this is how many people it involves, therefore I know what to do. Who's responsible for education awareness?
Sure. So we have a fantastic CEO here in our Central Valley network, and I'm sure there was more to this, but years ago he decreed that everybody needs to learn and improve. I believe it started at the executive level where they were taught Focus PDCA and Lean methodologies, and then the change acceleration process. Those are each buckets of kind of information that we teach. So Lean is a one-day class, Focus PDCA is a two-day class, Change Acceleration is a two-day, and Workout's a one-day. And then he decreed later on that all directors must take those classes. And then a further decree is kind of being played around with right now is, do we roll it down to the manager level where it's a requirement, or do we leave the requirement at director and let it authentically and kind of grassroots movement go on down when people are pulling the information out of their director? So at our last training class, we had everything from a manager, we had someone from HR, we had our security director. We get a wide variety of the organization that opts into it, and then we have some people that are mandated into it per our CEO's decree that this is something that is going to support not only our mission, our vision, and our strategy.
I see. Yeah, and I can see a strong benefit here, not just from a company benefit, more efficiency standpoint, but also you're getting people excited, you're getting people engaged, so everyone feels empowered in the process, so that it's not just their boss or their boss's boss telling them what to do. You got to do 3 process improvement projects this year, but then they also start to see the value because you're training the trainers and you're enabling them to apply these tool sets that are not mandated, but it's more of a way to help them think better, to help them process information, so that you're in effect tapping into their intelligence to go and spot problems, and not allowing just the directors or the executives to go and see what the top level problems are. You're actually starting a ground up, a grassroots level of observation, so that you get to the patient quality of care, you get to where the action is happening, and then you spot problems directly from there. So I can see that being very, very helpful.
Exactly. So, and then we have some super engaged directors that have taken it upon themselves. So our director of med-surg actually just sent 4 of her leads that don't even have a manager title. They're just lead nurses to come in and learn these tools so that they can aid in not only the identification process, but the solution process as well. and kind of lead their own teams, get them more effective, and start some succession planning.
Right. And this is you're, I don't know if you're deliberately or indirectly trying to create a culture of process improvement, because this is doing
Absolutely.
that. This is exactly what's happening, is that you're getting people whose day job isn't to go and identify problems. They don't have Six Sigma in their title, but they're actually doing it. They are, and maybe even without themselves knowing it, they're actually contributing to this bigger efficiency and optimization issue.
Absolutely. And then actually, there's one more thing to add. I didn't give you a slide around it, but we've been working with our clinics. So we've been working with 38 rural health clinics that specialize in serving not only the underserved population, but those people that can't necessarily get the access to care that we enjoy in the more major cities. And within those, the clinics have identified what they call their pursuit of excellence teams, which are taught the base bones or the bare bones of process improvement and performance improvement. So they're taught, like some of these tools on the right, I would say they're taught the majority of these tools. They may not get into team charters because they're solving, I would say they're doing focused PDCA, but they may not be defining it quite as much as even that requires. So they're learning to identify opportunities for improvement, just plan something around it, see if it's working, and action upon it. So we are getting much further into the culture of continuous improvement. Right now we're kind of playing with how does innovation work into this matrix so that we know, do we do focused PDCA, do we do a workout, do we do an innovation crowdsourcing challenge? And we haven't gotten quite as far as I'd like. I hope in the next year we can combine them. But since innovation, I would say it's core to what we do, and a lot of our employees definitely innovate. They challenge the status quo. They find great change in areas of the population, but how do we actually standardize that and include it into the culture that we have for continuous improvement is kind of where we're playing around with right now.
Funny you should mention innovation, huh?
Shocker, right?
So what we did recently, and I think we talked at length about this, Spigit does a business innovation report every year. This is our second year doing it, and we've been tracking what the key reasons for a given company is to decide to implement an innovation program, an ideation program, and to improve their process improvement, to go discover new products. And what's interesting to me is what you just said here is almost identical to our findings when the innovation department is involved. Our respondents, which are Fortune 500 companies across all industries, they said that 86% of them said that building a culture of innovation, and 78% of them said that increasing employee engagement in innovation, in process improvement, are the top objectives, the top reasons why their company decide to go and implement a program like this, which to me signals that the objectives are the same. They're trying to build a culture, they're trying to engage employees, they're trying to go optimize processes. Now it comes down to, okay, so how do we do it, right? And right now you're giving us a very good example here is the how, because most people just need to know, okay, so I know what the issue is, how do we do it? So perhaps you can tell us a little bit more about when it comes to the how, right? How do you pick an approach? What does Adventist do to allow your employees, allow managers, allow directors, allow executives to make the right decision in picking the right approach here?
Sure. So when it's decided that innovation is the solution or the approach that we're wanting to do rather than traditional process improvement or process excellence, this is kind of our matrix that we've been playing around with. It's definitely in its first iteration, and it might be tweaked a little bit in the years to come. But if you look at the
continuous improvement process, huh?
Yeah, right? It's impressive. So if you look at the vertical axis, this is the knowledge of the crowd. So if the crowd, basically what we're saying, if the crowd doesn't know anything about what you're wanting to solve, you probably need to go outside your organization to find some solutions around it. I mean, for example, if we're asking anyone at the hospital to design a new 3D interactive technology and no one knows how to engineer or design or anything. It doesn't matter how much we ask them to solve it, they're not going to be able to come up with it. Or if they did, it'd be a miracle. So that's kind of the very top blue bar that says innovation journey. Well, what we mean there, it means that we go outside, whether with one or multiple people from our company, learn some best practice, maybe consulting, maybe some partnering and collaboration with other companies. So that's kind of what we mean there. However, if you have relative knowledge on the subject at hand, you can do one of two things. The big orange box, that is Spigit software. That's when we crowdsource. And we say that we need to crowdsource if not everybody's in the same location. For example, if I'm running a hospital challenge for our Central Valley network, we have 3 hospitals. There's no way to get everybody into a room. So we definitely need to utilize the crowdsourcing software, which has been fantastic for those crowds that are really spread out. And then if everyone works in the same department and maybe there's like 10 people, you can absolutely brainstorm. You may not get the value out of crowdsourcing that you would by just getting them in a room and doing some nominal group technique. We do have some rules. This one's been a little bit further defined. We have some rules on when you can break those rules of the approach. When you're talking about concentration, if the size of the crowd is too small, brainstorm always. Because we found if you don't have 100 people kind of involved in crowdsourcing, while we can get some actionable outcomes, it doesn't really let Spigit be utilized to the best that it can be in those challenges that we've had more than 100 people. If the crowd's too large, obviously it's not going to work to shove 300 people in a room and have them brainstorm. So that's when we say definitely crowdsource, even if you all work on the same floor. And then vertical access knowledge, this rule can absolutely be broken if the innovation is disruptive. So maybe if we're solving how can we be quieter at night, absolutely the nurses have the knowledge that we need to solve it. However, if we're looking for disruptive innovation, we might want to go look out there, look at some steel case technology, look at what else is out there so that we can bring extra value back to when we're trying to innovate. Or if the industry at large has low knowledge, even though so if it has low knowledge, we need to do breakthrough and we can impart theory. So for example, if I was trying to, what's a good example? If we wanted to design something around what would the ideal experience be for patients, we can always bring someone in from maybe Nordstrom's or other companies that have a great reputation for experience. Disney, there we go. We've actually brought Disney in. So we can impart theory and then we can have them innovate and ideate around solutions.
When you say they, who's they?
Our crowd, whoever they might be. So if we're running a challenge on the med-surg floor, our crowd can be nurses, techs, nursing assistants, housekeeping, anyone that touches base or is part of the value stream of the challenge we're trying to run.
And who gets to make the calls at the end?
We have fallen on our approach is, if somebody has an idea of what they want to do, why not let them try it? And I'll give the example of, we have this fantastic lady named Kim at our corporate office who works with our CIS department, which has by far been our greatest kind of like hero story of using Spigit and crowdsourcing software. And Kim wanted to use it in a way that my brain didn't believe might be the best. However, she has just proven me wrong. So if I would have been kind of the key holder and I said, no, you're not going to run a challenge unless you agree with everything I agree with, we never would have had that kind of wonderful outcome that we had. I can explain a little bit about what happened. She wanted to pitch a question to the crowd in the IT space about how we might be able to improve our EMR, our electronic medical record. And she wanted to do just a blanket statement, how might we best improve it? And then once she got the post comments and votes that Spigit does so well, she wanted to then re-pitch 5 new questions out to the crowd at the exact same time, the exact same crowd that she just did, which went against my brain's opinion of letting the crowd rest, and having 5 things to the same crowd at once might overwhelm our crowd. So, however, she proved me wrong, and it was so successful that is their new process, whereas before, and they do it twice a year, whereas before they went through I think there was 4 or 5 sources that someone could submit a request for improvement to our EMR, whether it was email, an IT ticket. I think there was a couple Excel spreadsheets out there floating around. And then if one of our hospitals, for example, our hospital in Hawaii, submitted a request for improvement, there was no way to tell whether our 16 hospitals in California were on board unless somebody physically forwarded that out. And that hadn't been perfected either. So she basically took this kind of 120-day cycle of craziness down to an initial 2-week challenge and then a second 2-week follow-up challenge on, okay, so we've identified this is what we're going to improve. How do we best do that? So I guess in summary to your question is, if they have an idea they want to try, our Chief Innovation Officer and I have very much been well, let's try it. I mean, that's innovation in its root. So
right,
that's
yeah.
kind of where we've gone.
Yeah, and it validates a lot of what I've picked up on in this year's conference. So you were there just about 2 weeks ago. We had this annual Ignite conference, Ignite Summit, with a lot of the innovation leaders and our customers and people who are looking into this space. Great event. I not to self-advertise here, but really, I learned a lot. And one of the things that I picked up on resonates with what you just said, which is that innovation is messy, right? The front end of innovation, particularly, is very messy. If you put too much restriction or have too many rules around it, and don't allow them to break the rules like Adventist is doing, then you end up stifling the front end of innovation and doesn't allow for divergent thinking to happen. And so a lot of it just gets bottlenecked into what the top executives want, or what the person who's shouting the loudest or the most popular idea win. But in your case, it seems like your Chief Innovation Officer and you have created an allowance, some room for the crowd to not just ideate but also execute. You've enabled them to take matters to their own hands and not just give you an idea. And it also generates a sense of accountability, because it's not just, oh yeah, we should install another water cooler here. And why aren't they doing it now? Yeah, so it's more about not what the company can do for them, but what they can take matters into their own hands and actually make it happen. And this example from CIS is actually perfect for that.
Yeah, so I'll probably give her all the credit on the genius behind that. I was very green when I was coaching one of our executives through, might they use a crowdsourcing challenge or not. They wanted to do a crowdsourcing challenge with 7 people. And I remember talking to my boss at the time, our Chief Innovation Officer, and telling her, well, why would he do that? That doesn't make sense. And she basically told me, the best advice I've had in innovation is, who cares? Let's try it. He might be onto something that we don't see, and he might make this easier for us. The worst that's going to happen is it doesn't work, and we've wasted an hour. But then we learn. So it's that I've kind of taken it to heart. And the other thing that allowing them to kind of do what they want does is, I just was in a conference that had Pixar come and announce and kind of present. And Pixar, he brought up something around innovation. He says, just get something done so that we can fix it. Mm-hmm. So, I mean, if they start a challenge and we maybe haven't set the barriers, the graduation thresholds appropriately, we can change that mid-challenge, and it's easy to tell that. So with the challenge of 7 people, I want to say it was about 2 days before he pulled the challenge and then went to something that worked more effectively for what he was trying to do. So it didn't take very long, and I would say there was probably 10 minutes that wasn't utilized to the best of the ability, but we've also learned from that challenge, and no one has ever done that again.
Yeah, I see. And so just thinking about ownership here, you seem to have a culture of allowing a lot of decentralized ownership in the process. And some organizations that we're talking to, and some of our customers included, they have trouble understanding where should this effort be coordinated through. When we're talking about innovation, when we're talking about process improvement, they sometimes are rooted in completely different parts of the organization. And the expectation is that for each of them to come up with their own mandate and then go and execute it. And sometimes just wires get crossed. But what you're sharing with me now, it seems like Adventist has a culture of decentralized ownership that actually works pretty well. That it crosses the boundary between innovation and process improvement, Six Sigma and Lean and brainstorming, all these different tool sets that could live in different places of the organization. How did you manage to do that? How do I, is it really matrix? Is that a necessary ingredient for Adventist to be so successful? Or is it something that you've actively cultivated, that you've broken some silos down, you've taken down some of the boundaries between care facilities and across regions?
So I would actually say that on our journey to become more of a one Adventist health model, we are doing many prototypes on how that might look best. So I currently work in the region that has very much supported breaking down the silos and kind of letting people do what they want to do, letting them try it. And the only kind of rules that I believe we put on place is that you have to fit the sponsored definition. You have to actually have the scope, the power, the knowledge, the ability, the budget, the resources to do this kind of stuff. And then if you do, why would you have to go to someone else to do it? If it's your department, so say you're the director of, I don't know, say you're the director of housekeeping, why would you have to go get permission to improve? However, there are, of course, some restrictions placed on that. It's got to be aligned with strategy. We do have our process excellence department that's available for coaching, which is utilized quite a bit. And we do have that process improvement committee that gets all of the feedback from all of the peers and other directors to give you kind of pluses and what they might change. However, some of our other regions have opted into more of a centralized model where our corporate office does have a process excellence department. I think they're called something slightly different. And they might choose to pull a black belt from corporate to help them get through one thing. And then that one's done slightly differently. I don't know if that helps. So we haven't defined which one we like or which one we're going to go with as an entire system. However, my observation would be more of the breaking down the silos and giving the power to the people that can actually do something. To me, there's no reason to wait for me to become available for anyone else to be able to start thinking about how things could be done better.
Right.
I guess in my mind, I'm here to help them overcome barriers, not to get started.
Yeah. Oh, this is. I'm learning a lot here. So thank you, Joe. And so 2 more questions. I'm sorry. I'm taking time away from the audience, but I'm just so curious about this. One thing is, when you say that you're applying crowdsourcing to solve a problem, how? And I'm just curious. How is using a tool like Spigit helping you to go and break some boundaries, break some barriers or silos down? Or is it doing that, or is it not doing that? You can be honest with me.
So it is. So I have to go to our Ukiah Valley Medical Center, ran a challenge around the noise level at night. They were facing some pretty interesting kind of coincidences that were going on at their campus. For example, they were doing a parking lot remodel. That's loud. That's jackhammers. That's a lot of stuff. And while it wasn't occurring at night, when a patient's faced with that kind of noise all day, the last thing they want is to have their blood drawn at 5 a.m. and to hear the nurse check up on them and the beeps and doodads of the healthcare setting. So they ran a challenge around how might we best increase patient satisfaction around the noise. Since there's nothing we can do about the noise, how can we make it better? And by doing a crowdsourcing challenge, rather than just asking the people that work on the unit, they were able to get, I think one of the winning ideas came from their maintenance staff. And pardon me, this has been a couple of years since this one happened, but it allowed them to get a cross-section of the culture. So they had nutritional services talking about a squeaky wheel on one of their carts, and maintenance was able to put some oil on it and get it all fixed. I'm sure it was a little more complicated than that, but something came up that it may not have been like the winning best idea out there, but my goodness, if we have a squeaky wheel, let's get it fixed. Other things that occurred were patients were able to speak with the nurses, and the nurses were able to input the patient's suggestion. We saw ideas, everything from redesigning the entire room like a I would say like a musical room so that the acoustics are better for noise, all the way down to how do we actually script out a conversation for our patients about, I realize that the hospital may seem like a very quiet area from the outside. When you're a patient, you start to realize it's not. And while we're doing everything in our power to make sure you're comfortable, we are going to wake you up at 5, and there are going to be some noises. Please let us know. And so they found that they were able to collaborate with a much larger idea pool and more brains for less effort. It actually required almost nothing on the ongoing 2 weeks that they were doing it, other than to mention the challenge every morning during their morning huddles.
Gotcha. Wow, that's interesting. So one last question before I turn the questions to the audience here. Tell me about your dream world. What would ideally process improvement look like going forward when you think about integrating the collective intelligence into process improvement and innovation?
That is a loaded question. I think my dream world would definitely have resources. We would definitely have a process excellence innovation department. It didn't really matter what you call it, but there would be a pool of people that might be pulled for coaching on a moment's notice. So if I, as an employee outside of the innovation and process improvement arena, had an idea, I would be able to go vet that, whether it's a possibility for rapid prototyping. One of the examples would be this girl in our emergency department, I think, duct taped the stapler to a tape dispenser. And it was needed because she always needed tape and staples at the same time. And she didn't know where to go to see if the rest of our kind of organization could use this. And by the time, years later, somebody with some innovation experience saw it and then looked up patents, it was patented like the year before. So this girl actually innovated and invented a new functional thing that she used every day and the entire department used every day. And then there was no one there to help her get that out there. So there would definitely be a department of people. However, I also really believe in what we're doing here in the Central Valley Network, where we're giving the power to the people and trying to eliminate those silos. I would really like, I think in the future, strategy does need to be set by what the world is doing, what the government's doing, and I understand the need for maybe some hierarchy around strategy. But I would say as long as strategy is set and you have your key strategic initiatives, allowing your workforce or even your patients to innovate around that and to fix processes and to make you so much higher quality would be very beneficial to eliminate the silos and the need for only a director to bring it forward. I don't know if that made any sense. I think I just did like a word blah.
Oh, it's great because I like catching you off guard. But what I got out of that is that innovating or ideating, it's not just about engaging an internal audience, but also there has to involve a lot of different stakeholders, and stakeholders sometimes that fall outside of the organization. You mentioned patients.
I look forward to our first patient-led challenge.
Right? That would be so interesting, right? To understand their perspective, what kind of noise they're hearing at 5 a.m. and how can you fix that squeaky wheel so that they stop complaining at 5 in the morning. So also it delivers a better patient experience, which allows you to be the healthcare innovator that you guys have always been. So that's really interesting. So now I'd like to open up the floor to the audience here, see if we get any questions. Hannah, would you help us collect some questions?
Yeah, absolutely. We've received a couple good ones. If you do have any other questions, please do go ahead and submit them. First one from the audience. How have you used the Spigit platform to help drive your change acceleration process program?
We are officially in the very beginning stages of that. So we have Actually, I'll speak to a learning from us. When I came down to the Central Valley Network from the corporate office, we came off of some really big successes where it wasn't officially linked with process improvement. We were kind of playing around with, does innovation belong in business development, strategy, process improvement, all three? How do we do that? And I came down to a regional level where we had a little bit of experience from the corporate. They had a very, very robust process improvement program in general, and we were looking at how does innovation fit into this. And we made the mistake of doing so much kind of approval processes that by the time you had to get it approved through 3 to 5 levels, the interest broke off, and the need to do some crowdsourcing, some innovation was eliminated as they just did it on their own while everything was getting approved. So we are kind of working, we've made some adjustments, so now it's, if you have scope, you can run a crowdsourcing challenge, and all you need is to contact me as the one that can actually get it on the website, and I'll do whatever they want. Some of our sister hospitals have been able to train some subject matter experts on the Spigit software as well, and they're seeing, I would say, like more rapid change, but I don't know whether it's completely tied into their process improvement journey. I believe most of them are tying it into employee engagement and how they can get their opinions to count. I don't think I answered the question, but I don't think I can give you anything better.
No, that was fantastic. Thank you. Next question. Can you touch on the culture aspect of the decision matrix? What are the best practices you can share?
Ooh, I think the best practice, I touched base a little bit on it before, the best practice is let them try something. If they want to improve something within their department, and it doesn't matter what it is, so even outside of healthcare, if you're wanting to do anything, let them try, because you're either going to learn or you're going to solve it. And probably both is going to occur, or some form of that. So when it comes to the decision matrices, they're not meant to be a kind of end-all, be-all. If you're, for example, the one we're on, if your crowd has low knowledge, you're not allowed to crowdsource or brainstorm. It's just kind of meant to help them make the decision, not to mandate it for them. Yeah.
Perfect. Thank you.
Good questions.
I know they're fantastic questions. We have a very engaged audience, so we do appreciate it. Next question from the audience. Can you provide a sample challenge question?
Oh, tons of them. We've run challenges from how might we best improve our EMR, how might we best improve satisfaction around noise. I think those are ones I mentioned, but it was phrased better. How might we do something? The biggest, I guess, advice I could offer around that is I really enjoy the how might we. It leaves it open. It doesn't suggest a solution to the audience, so the audience is actually free to give their unbiased idea. For example, our Bakersfield Hospital is about to run a challenge around where might we best give $1,000 back to our community. They're doing this purely for employee engagement. They want their employees to know that their opinions do matter, and they want to be able to support what the employees feel is valuable. And there was a lot of talk around, well, what if they say, you know, let's support Billy's baseball team? And the idea was, well, okay, let's support Billy's baseball team. It's $1,000. Maybe we can do some hydration stuff with it. So the where might we or how might we, that would be my biggest suggestion. Also, I believe there was a guy named Doug, actually, that works for Spigit that had a book on designing the question. It was a great book, and he had some great pointers on what makes a good question. I'm sure that someone from the webinar could get that to you, whoever asked that question.
Yeah, absolutely. And Doug Collins had written that book, and if you are interested in receiving a copy, just go ahead and type into the question box, and we'd be more than happy to provide one to you. So.
We might have time for one more, Hannah. I know there's a very active audience out there.
Okay, I'll pick one more. This is another great one. What is your reward program to encourage executives, directors to implement, and then employees to participate?
So I would say, let's start with the employee rewards. This was actually a hot topic at Ignite also, and my background in psychology, this makes it a passion about me. So rewards for employees or rewards for patients or whoever's submitting their ideas, in my opinion, needs to be varied. I always push for intrinsic rewards. So how can you build your audience to be a more functioning, more innovative audience in the future is kind of where I go. So if it's a training or if it's being able to implement the winning idea, if they're the ones that submitted it, that tends to kind of spark the passion in the audience. I actually would like to give a kind of off-kilter one. Play to the culture that you have. Our Ukiah Hospital, when they ran that Quiet at Night challenge, they had a CFO named Aaron Poole that apparently really liked Twitter and hashtagging, and he had created a kind of joke mug that was sold at the coffee shop or at their patient store. And you could buy a mug that had Aaron Poole's face on it, and on the back said hashtag Aaron Poole. So they offered whoever won a challenge got to design the next Aaron Poole mug. So it would be like hashtag innovation, and they got to design it, whatever was on it. So while that might not actually fly at maybe the hospital I work at now because no one would get it, they had gone through like 4 or 5 purchase orders for this Aaron Poole mug. It was a hot commodity. So to be able to design your own and have that sold at the gift shop was a huge benefit. But it was intrinsic. It wasn't an extrinsic thing. I always put some caution on extrinsic gifts, for example, a $20 Starbucks card, because what CEO is going to do something or not do something based on a $20 Starbucks card? So it might work to get your kind of entry-level employees involved, but you're actually going to eliminate interest from people that don't see value in that. So the key is to offer value to multiple levels. One of our sites came up with the innovation wheel where they said if you win, you can get one of these 10 things or 3 of these 10 things. And then that way the person submitting or the person ideating was able to pick what resonates with them. And then how do we get executives involved? It's very much if you want to solve something and you want to see benefit in your department, your organization, this is a tool that could get you there. And other than that, there's not much more we have to offer on actually fixing something or making it better. They're pretty passionate about doing it themselves. And then that's it from that. However, I would like to put it out there that if anyone is interested in, I would love to update my matrices. So if anyone has ideas on how to make them better, I would love to hear it. And at the same rate, I'm happy to offer any more knowledge to anyone else that's interested in collaborating.
Thank you, Jill. That's very generous of you, and thank you for giving us imparting wisdom here. So if I might, I've been jotting down some notes here, just curious if I can summarize it, and Jill, you can tell me if I got this wrong. There are 5 things that I took away from this conversation at least. The first one is that it takes both education from a centralized group of people who are knowledgeable and also the grassroots interest to make this happen, right, to make process improvement a success. The second one is that you got to empower people with a way to think, not rules, but a methodology, a way to think, like the decision matrix that you have here, so that they can go and discover process improvement initiatives on their own. And the third thing is that always leave room for breaking rules, right? Because the more room that you allow them, you'll be surprised with the results if you let people explore and if you let people just try it. And then the fourth one is that this goes beyond, when you think about crowdsourcing, when you think about engaging an audience, it's not just about your employees. It could also be about your customers and your patients and a broader audience that extends beyond your internal organization. And the last one that I've learned, which I think is the most important one, is that yes, you got to help people understand how their ideas fit the sponsor's definition, whether they have budget, or how does this connect to the overall business strategy, the benefits, the business case. Yes, but the most important part here, it seems like you've heard of the term, everyone's familiar with the term, build it and they will come. But I think what you've shared here is actually inspire them and they will build. Right? It's about getting them to be inspired enough that they will go and build things. They will go and make it happen, rather than trying to centralize everything and trying to make it so that it's only a small group of people making decisions on behalf of the crowd here. So
Absolutely.
those are the few things. I hope I captured it right. Did I miss anything, Jill?
The only caveat I'd like to put about don't be afraid to break the rules is in healthcare, of course, we have regulations that we are not allowed to break. However, I have found that a lot of what we think are regulations, especially from the entry-level employee's perspective, is because somebody once upon a time told them, and it's not actually backed up with current regulations.
Yeah.
So I get that a lot of what if we run a challenge and the winning idea, or what if we do process improvement and we post an idea that everyone loves that's against, JCO or CMS. And so I've learned, at least in crowdsourcing, we can put a level of, is this okay with regulations, and let the industry experts on regulations address it at that time, and don't limit the crowd. So yes, break the rules, but there are limits to breaking the rules.
Right. Yeah, play within the bounds of legal limitations and regulations. Right. Okay. Well, Jill, thank you so much. This is a real pleasure to talk to you always, and I feel like I always walk away with new insights and new ideas to think about, and I hope that the audience has learned just as much, if not more, than I did. And Jill, thank you again for offering your time and your resources and your brain to help us continue this dialogue. And at Spigit, we try to create those opportunities as much as we can. And so just a quick reminder to those of you on the phone, there are actually upcoming dinners and events that we can use to continue this dialogue, and not just with Jill, but folks like Jill who are really knowledgeable about the fields that they work in innovation and process improvement and new product development and building cultures, and that's happening all over. And so we're trying to get these dialogues going and continue it through these dinners and events throughout the year. And we have events throughout. So the first one, the next upcoming one, is going to be in Baltimore, and then it's going to be in Houston. You can see it's all over the country and also internationally. So I invite you all to ask us to sign up for some of these dinners and get in touch with us. And we will be sending a follow-up email. So simply reply to that and let us know that you're interested. Dr. Waters, thank you again for your time this morning. Really enjoyed our conversation with you.
Thank you. My pleasure.
All right. Thank you, everybody.